Today on Cancer Buzz, rethinking care delivery in oncology. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Our guest today is here to share how his team is helping to transform oncology care delivery. Hunter Hayes is an associate principal at the Chartis Group, based in Chicago, Illinois.
So the article is a co-authored piece between myself and Atrium Health Wake Forest Baptist Comprehensive Cancer Center. Back in 2020, kind of 2021, coming out of the pandemic, they were looking to come back to a sense of normalcy in terms of their cancer center volumes. And our role was to reimagine their patient experience, grow the volumes, bring in a multidisciplinary experience, centralize on breast cancer.
Why is it so important for cancer teams to read this article?
So I think cancer, and more broadly in the healthcare world of America, there's so much change happening with the way care is being delivered, and transforming to utilizing APPs, utilizing virtual care options, being able to get patients in quickly, being able to retain them for their full treatments within cancer is incredibly important. Competition is growing, and being able to keep those patients in and keep the experience high is just it's an evolving piece in the field. And back in this time period was the early time for us to really be thinking about that. It was the right time coming out of COVID of how do we reimagine how we're delivering this care.
What are the main takeaways?
I think the main one is when you think about multidisciplinary care in cancer, you're solving for three things simultaneously. One, the patient experience is going to be amplified. It's going to be better. Two, they're going to be retained longer and there for their entire course of treatment. And three, your provider team, your care team, your physicians, your APPs, your nursing staff, everyone that's around delivering that care is elevated at a next level, and you bring a lot of employee satisfaction on top of that. So it's a kind of a triple aim.
Any closing thoughts you'd like to share with our audience?
I think as I've worked in my consulting career and broader than just cancer, looking at healthcare generally, I see this trend in organizations that are financially doing really well or on this kind of positive financial operating margin versus the ones who are really struggling. There's a correlation to what you see, and what this article touches on a little bit. It's the use of APPs and it's the use of virtual care, redefining and rethinking about the care delivery. How do you better leverage your physician's time and these other resources in the midst of burnout issues, in the midst of physician shortages? We have to think differently in how we deliver care. And when you see the correlation tied to that, to the financials of big healthcare organizations, the ones who are doing the good to great, they have intentional efforts around this care team deployment. The ones who are not doing as great, it's kind of secondary thought. They're in this survival mode. And so I think there's one piece that I would really hone in on. It's be intentional about thinking about redesigning the care team and the care delivery, because it will impact the patients, it will impact the system, all for a greater good.
Thank you, Hunter. If you want to learn more about how Hunter and his team helped transform the patient experience and improve the timeliness of care for patients newly diagnosed with breast cancer, read the full article in the Volume 39, Number 2 Oncology Issues, coming soon in your email inbox from ACCC. Thank you for listening. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.